In 2012, a very historic event took place in Dublin, which is the International Symposium on Maternal Healthcare. And at that symposium, a number of experts from around the world came and shared testimony and shared clinical research and experience in relation to high-risk obstetrics, cancer and pregnancy, mental health, epidemiology, etc. I believe it's printed in some of the packs there, which is now commonly called the Dublin Declaration. And that declaration simply reads, as experienced practitioners and researchers in obstetrics and gynecology, we affirm that direct abortion is not medically necessary to save the life of a woman. We uphold that there is a fundamental difference between abortion and necessary medical treatment needed to carry out to save the life of a woman, even if such treatments result in the loss of life to her unborn child. We confirm that the prohibition of abortion does not affect in any way the availability of optimal care to pregnant women.
And so as physicians, as people taking care of pregnant women, our first and most important doctrine needs to be first do no harm, primum nocere nocere. That means that we take the interests of the mother and the interests of the baby into consideration at all times, and we don't look at those as competing interests.
2007, we were ranked as the safest country in the world for a woman to have a baby by the UN. So our maternal health record speaks for itself. No matter what international body or international study you look at, Ireland consistently ranks in the top 5 or 6 of the league tables with regards to maternal health care, and we are a country that have a ban on abortion.
And we observed that after abortion was prohibited, maternal mortality continued to decrease, reaching the lowest abortion-related mortality of the Latin America. And in fact, maternal mortality today, specifically for abortion, is negligible. The total reduction of abortion mortality in Chile is 99% today. That is practically complete reduction.
I think that the maternal death rate in America is probably lower than other countries.
I would think maternal death rate in America would be really low based on we have, good facilities, hospitals, doctors, people willing to take care of their patients.
If you look at the maternal health records that the UN, the WHO, UNICEF, UNFPA and the World Bank put out, they consistently rank Ireland in the top 5 or 6 countries in terms of our maternal health record. Ireland here is 6th, with a maternal mortality of 5.7 per 100,000 live births. The UK, that have legal abortion up to birth in cases of fetal abnormalities, is 8.2. The USA, and you guys know your abortion legislation here, it was somewhere in the region of 16.7 maternal deaths per 100,000 births. So recently there was testimonies by obstetricians before the Irish Parliament who also confirmed that they did not know of any cases where treatment was withheld from a woman who needed it because of her ban on abortion.
Looking at all the risks from medical abortion, the increased risk of hemorrhaging, the increased risk of retained tissue, the increased risk of women with an ongoing pregnancy, medical abortion is likely to increase maternal mortality, not decrease it.
But abortion legislation is not a component to improve maternal health. That is a matter of scientific fact. At least in the case of Chile, this is very well demonstrated with very good data. In this slide, side-by-side comparison, it becomes clear that both global and abortion-related mortality have continuously decreased since the abortion ban, with an outstanding 96% decrease of abortion-related mortality since 1989. We conclude that the legal status of abortion was unnecessary to reduce maternal mortality in the Chilean case.
So a ban on abortion does not jeopardise women's lives. It doesn't put women's lives at risk. It doesn't mean you need to withhold life-saving treatment. Ireland's ban on abortion is not just symbolic. It's proof that a country can prohibit abortion and at the same time achieve a standard of maternal health care at least equal to, if not greater than, countries that have abortion on demand.
We are the youth. The world is in our hands, so if we don't do something, who's going to do something? So I want my kids to grow in a perfect family. I want every kid to grow in a perfect family. So it's our job to make that possible.